so this is the Glut Medius exercise level 2. Again, this is simply just a variation on level 1. We talked about concentric and eccentric. And this is just simply the addition of a leg weight. Again, just for simple review, if we put the leg weight at the knee, obviously the lever arm from the Glut Medius is not as long, so this is going to be a much easier exercise. I tend to put the weight at the ankle as a starting point, and if they fail there, then I will move it up to the knee. So I always like to try to go a level a little bit above where I think they may be successful, and then move it down from there. Again, with this particular exercise, what I'm going to have to do is the patient laying on their side, slight extension, slight external rotation, abduction. They're going to move into this position, right down slow. Again, I'm going to have them focus. Go ahead. I'm going to have them focus on the eccentric component of this exercise throughout to really emphasize that. Again, what you can do from a manual perspective is follow this up. Go ahead and bring it up and hold. Bring it up and hold. You can throw in some of your manual techniques with it. Now, I will say when you're doing the manual technique, I'm not simply pushing straight down. What I'm doing is I'm resisting all of those components. He's slightly externally rotated, so I'm slightly internally rotated. Internally rotating, I'm adducting towards midline and flexing. So I'm going exactly the opposite direction of what his motion is. And again, go ahead and do that again. You'll notice he's fatiguing, so he's rolling his hips out. So we would want him to keep his hips in like that. Very common compensation. And again, I would use repetitions to substitution. I would only have him perform as many as he can where he can keep that hip like that. If he's so fatigued that he can't do that, then I may move to a manual position where I place him in that position, resist, and then I may go back to the manual techniques that we do. That's level 2.